Today we're doing a hair transplant. Now our patient was able to get insurance to help pay for the transplant. Why? Because the patient has gender dysphoria. The patient is non-binary and we're doing a transplant for their scalp to fill in the loss they have had and to create a more feminine pattern. So for our patient today, we're doing follicular unit transplant with a strip technique. Now I do two techniques for hair transplant. I can either do strip, where we take out a small strip of skin, suture the edges up. Now when I make my incision, I make a trichophytic incision, where they're beveled, so when I stitch it, hair goes through the scar area to minimize the scar. If we're doing it that way in this patient because she doesn't want to shave, she might have multiple of these, and when we do a strip, we can come back and do more strips or do FUE on top of it. Now the other technique is called FUE, follicular unit extraction. In FUE, what we do is we make no incision. We make no incision, but we use a handheld device to remove individual follicles, and then we transfer those follicles. So the whole back of the scalp has holes in it. Whereas with FUT, there's a small line, typically ear to ear in the back, with a small incision that heals in a trichophytic fashion, so there's really essentially little to no scar. There's 3 phases for the operation today. Phase 1, we're gonna go ahead and harvest the strip, and we'll close it. Phase 2, I'm gonna make the recipient sites or the little holes where the grafts will go. And then there'll be phase 3 where we're gonna put the grafts in the holes. It's gonna be an awesome case. We're gonna feminize the hairline, we're gonna fill in the loss. We're doing 3,000 grafts. Let's do it. We're first gonna do a block of the greater occipital nerve. To do that block, I'm gonna feel what's called your mastoid tip, and then I feel the nuchal protuberance, which is right there, and 1/3 of the way in between is gonna be the nerve. So you're gonna feel a little poke on 3, 1, 2, 3. We're doing our nerve block for the hair transplant. This is the worst part. Now we'll do the other side. We're doing a nerve block for the strip. So we feel the nuchal protuberance right here. We feel the mastoid tip right there. 1/3 of the way in between is going to be the nerve. So we go straight in and we inject a bolus of medicine. It's going to help numb the scalp. And now we're going to numb the entire strip area and a little bit above and below. A little poke on 3. You feel that? Is it 10 out of 10 or is it a little bit less? Okay, good. Now we're numbing the entire strip area. This is going to be the worst part of today. Fantastic. The side's gonna hurt a little bit. Sides always take the longest to numb. We're gonna try to do a no shave procedure. It'll just take us a little bit longer, but if we struggle and we feel the grafts are getting stuck in your hair, then we'll shave. Okay. Sound good?
Yep.
Okay. All right, we're gonna get everything cleaned with some surgical prep and we'll get started soon, okay? All right, friends, we're gonna be doing FUT or follicular unit transplant. We're gonna be harvesting the strip. We're gonna take this out, stitch around it. It'll come together, so then there'll be a very small faint line when it heals. That's the goal. And then we'll take the strip under the microscope and separate the individual follicles. All right, our first step is we're gonna make our incision. So we always cut on the bottom first so the blood doesn't come in the way. Are you ready, my friend? If you feel pain, let us know, okay? We're doing what's called a trichophytic incision for you. And what that means is when we stitch the incision closed, the goal is for the follicles to go through the scar. So the way you do that is you make a beveled cut on the bottom or inferiorly, and we make a juxtaposition or we make an interlocking. The way we do the trichophytic incision is we make a beveled incision on the bottom, and then we make an interlocking incision on top so they overlap so the follicles go through the through the incision. Am I hurting you at all? So we always cut on the bottom first so the blood can not be in the way when I cut the top. Fantastic. Get a fresh blade. I always use a fresh blade for each cut so I get the sharpest cut. Sharp edges heal better together in my opinion. Now I'll make another cut up here. Again, I'm beveling. Look at my blade is not 90 degrees like when I normally make an incision. I'm almost flat with the scalp here. And so what will happen is this edge will overlap with this edge so the follicles go through the scar. It's called a trichophytic incision. We're going to cut the tissue off. We're going to use a towel clip to grasp it. You might feel a little blood there, that's normal. I'll start with the blade, just to get it started. And now I'm going to remove in the subcutaneous plane. Are you feeling pain? Okay. Does it feel sharp or just dull pressure? Okay, sounds good. So now that we've started our strip harvest, you can see we're in the subcutaneous plane. Below there, you're seeing fascia. And we gently cut in this plane once we've established it, and we glide along this plane. I know this feeling is not appealing, but we're gently cutting, protecting your follicles, okay? I'm using the natural plane or space of the body for my strip harvest. See, when you do it properly, there's minimal bleeding. We're doing it mainly local anesthesia today with some IV sedation. We have anesthesia in the room, helping manage the patient's safety. We always have somebody monitoring the patient. Perfect. Okay, now we'll hand off the strip. I'll save this towel clip. Thank you, Fang. That's going to go for processing. Now we're gently going to put the scalp together. We'll stop any bleeders. I'll get the bipolar. Now you might smell something that's not appealing. We're using heat. This is the tool. It's like a tweezers that stops bleeding with electricity, okay? Can I have on, please? Pass it. Yes, we stop that artery there. And we go after the big vessels. The small ones will stop. Now we're going to reapproximate the scalp. We're using what's called a penetrating towel clip to reapproximate. Very beautiful low tension closure here. Fantastic. When we do surgery, it has to be a beautiful symphony, an orchestration, an organized, cohesive procedure. Now we're gently going to start suturing. So we're done with the harvest. Now I'm doing the suturing for you. I'm putting the scalp together. You're going to feel some tugging and pulling. You can't eliminate that. I'm doing what's called a running locking suture with a dissolvable stitch called chromic suture. We're going to, my assistant physician associate, Emily, is going to help me do a locking suture, which means we're going to capture the suture in on itself to help decrease tension and help get hemostasis at the same time. She'll give me a small 1/2 centimeter tail. Beautiful. What we're doing now is a ring block where we're going to numb the forehead, and we're going to go around the periphery or where we're going to do our procedure So we get the nerves coming in, then we'll get the area where we're doing the procedure too. But we slowly march along. The sides are gonna hurt the most. Fantastic. The other side. This is called the ring block, where we numb around the area we're working in. Good. Now we're going to numb everything up. Make it nice and taut. And when we are doing the transplant, what we do is we make a very precise grid pattern on the scalp. And we make a precise number of holes per grid. And what that does is it prevents us from getting empty spots or gaps. Some people just eyeball it. I don't think that's the right way to do it. By having a grid pattern, we know exactly what we're putting in each area, and we minimize any risk of having any issues. So what we're going to do now is we're going to make our recipient sites for the grafts. We're going to go from the hairline down, and we'll go through each and every single one of these. It's going to be fantastic. So in each one we're going to make 5 holes. So we're going to start with that. Fantastic. I'm making them in the direction and orientation of the natural hair. So whether you're doing FUE or FUT, the hole making process is the same. It's just how you get the grafts. All right, friends, these are our recipient sites that we've prepared. We'll be putting the follicles in. Here are the follicles that we prepared. These are follicular units that have multiple hairs in them or singles. We gently grab the follicle without damaging it. And we line it up with the graft site and gently place the follicle. And that's how you do it.